Hello, and thank you once again for joining Pod Bites, and Happy New Year to you. I hope 2021 is starting out well for you. I'm Verna Collins Odoom, and we're here to talk about a topic that truly has dominated the news in 2020, and for good reason, the coronavirus or COVID 19. To date, COVID 19 has infected 20.5 million people in the United States. It's claimed nearly 351,000 lives in the US alone. Several vaccines so desperately needed finally were approved. It has been nearly 3 weeks since the first COVID 19 vaccinations were administered in the United States. Most of us are not in that group that's the first to receive the shot. So, like many, probably, I have been wondering what it's like for those who have been inoculated. So, I invited someone to join me and talk about just that. Dr. Bradley Collins is Associate Professor of Surgery and Surgical Director of Kidney and Pancreas Transplantation at Duke University Medical Center. Thank you so much for joining me, Bradley. Dr. Collins, happy New Year to you, by the way.
Thank you, Verna, and Happy New Year to you too.
And I should mention to everybody that Dr. Collins is my brother, to whom I typically refer as Bradley or Brad. So we might get a little casual here, which is good. Just so happy to have you to be able to kind of give us a little bit of insight today. And I know that you've already gotten your shot. Tell me, how long ago did you get your shot, Dr. Collins? Brad.
My pleasure. My pleasure. Thanks again, Verna, for the invitation. And Brad is fine. I received my shot 2 weeks ago, and the I received it at work. I got an email that told me that it was my turn to get it, and I scheduled it. The day was routine. They have it well organized here at our medical center. I was there for about an hour, signing in line, getting the vaccination, and then a 15-minute observation period. The young man who did the injection did a great job, and the process was just fairly benign.
Okay. So you said there was a line. Was it a line of many? Is it kind of a rotating system that they have going on there at Duke, or I
Yes,
know it's all happening all over the country, but just you're specifically speaking about your facility. Tell me how that looked.
right. A number of people are scheduled at the same time, and they have lots of days where you can receive your vaccine. But so that the process continues to move, they invite many people there at a given time. We check in, we wait in the line for a period of time, and then when the bay opens up, you get your vaccine.
Okay. And I meant to tell everybody, by the way, we have our 10-minute timer started it a few seconds late, but we are a 10-minute show trying to get people in and out with as much information as they can get. So, Brad, did you feel any different after the shot? Was there any kind of, I know you said it was pretty benign, nothing really happened. Any soreness in your arm like the flu shot? That's what I'm thinking of, the flu shot.
Gotcha. Everyone has different reactions to vaccines. Mine didn't hurt that day. I had a little soreness at the site the following day that went away by the second day after the shot, and I felt fine. Certainly, with these vaccines, they say that after the second dose is when people can sometimes have fever, and they ask you to get that vaccine on a day that you don't have a lot planned to do.
Oh, okay. So something maybe if you need to rest or if you have some kind of a little bit of a reaction, you're able to kind of lay low for the day.
Correct.
Okay. On a personal level, what would you say you felt to be among the first who were vaccinated? Did you feel like you had done your duty or you were protecting others and yourself, or just kind of something off your checklist or something that you had to do because you work at a medical facility?
A number of those things, and all those things that you mentioned. I'm of age. I have some medical comorbidity, so COVID is an illness that I have done my best to try to avoid.
Mhm.
Um, every person who gets COVID has a different course, and you just can't predict how you will do. And I just didn't want to take that risk. So I was glad that I was early in the vaccine process. Of course, it's not over, and you're not really immune until 7 to 10 days after the second vaccine. And still after that, I'll have to take precautions because my family members are not protected. So we'll continue to do the things that we've done to maintain the social distancing, masking, that sort of thing. Just because I have the vaccine, I don't feel safe still.
And I think that's what a lot of people probably are interested to know because obviously it's not a one and done because you have to have the booster shot. But some people would feel that after they have their vaccination, that they are pretty good. They're not going to get sick. But then I think about the flu, and you can still get the flu once you have a flu shot. So, how do you think that's going to kind of work in the minds of folks after they get their booster shot? Do you think we're going to see more people? I know I'm just asking you to predict something, but what is your thought about that? About what's going to happen after that second shot?
Well, your example with the flu is great. I will tell you that because these vaccines are so new, they don't know whether the vaccines are completely protective against the virus prevented. For instance, if you get a measles vaccine and you're exposed to measles, you won't get measles. But there's some illnesses that the vaccine causes you to have a much milder course of disease. And they still don't know whether with this COVID vaccine, whether you get it and you're exposed to it, you have a mild course and you're still infectious towards other people, even though you feel good, you may still be giving others COVID. So that those studies are still being done with this vaccine. So again, I'm going to assume I'm going to still do all the things that I was doing before, even though will have had both shots by the end of this coming week.
Okay. And you and I, obviously, brother and sister, talk a lot. And you've told me in conversations that you really had no concerns, no reservations about getting inoculated. Did you do a lot of research before getting the shot, or is it more you're part of that medical community? You kind of know how these things run and you felt confident in the systems that were in place?
A little of both. Being in the medical community and seeing how studies are run, having participated in studies, I know the precautions that are taken. It's unfortunate that this whole process became politicized, and a lot of folks, rightly feel that things were rushed. And the reason they feel that is because this has been in the press every single day, so all the nuances were discussed on television. Lots of times those things happen behind the scenes and you show up, for your treatment and you're good. But something like this, every bit of it was in the news. But no, I felt confident in the system. Of course, I did a little bit of research and was happy to go when my turn was called.
Okay. Now, I know there's a group of folks that is a little more concerned and leery, actually, about getting the vaccination. Among that group, some African Americans, some Hispanic folks who maybe feel, based on historical reasons, and like you said, it being so politicized, that they are not as excited about getting the shot. What is your thought about that? What can you say to those people, and how important is it for us to get buy-in from a wider range of people?
That's very important. You and I offline discussed herd immunity, and for the for our country to to get that, most people will have to be vaccinated, and that includes all ethnic groups. Um, our country has a bad history now with respect to peoples of color. In interest of full disclosure, you and I are from Tuskegee, Alabama, the home of the syphilis experiments. And I read something interesting. A couple of ladies who were the daughters of victims of the Tuskegee syphilis experiment were asked what they thought about the vaccine,
Hmm.
and they said that the study that their fathers were the study that their fathers that study they didn't get treatment. There was no option for them to get treatment, and they didn't know it. They didn't know they had syphilis. They didn't know they weren't getting treated. But in this instance, we have the ability to know that we will get a treatment, that it is equitable. And they recommended, these daughters of the victims recommended that people get the vaccine. When you have role models getting the vaccine, certainly Kamala Harris got it. The Surgeon General, who's African American, got it. And these are people that they know they've been given the science. They know the importance of it, and I think that if you have role models stand up and are willing to get the vaccine, it'll show others that it's safe.
Okay. And I know really briefly, because we're getting close on our time, you and I talked
Okay.
about the fact that the flu shot, we have about 3 minutes, so we still are good. The flu shot, we talked about, is just like 50% of the population gets a flu shot. So you and I
Right.
were talking about, we're looking at potentially needing like 80%. Is that what you were saying?
Right. It's got to be a high percentage of people who have been vaccinated. And the thing again, because this is a novel coronavirus, it's a new disease. No one knows whether the immunity from the vaccine will be long term. Will this be a flu situation where you have to get it every year, or whether it's going to be a lifetime like measles where you're protected? No one knows.
I think one thing too, Brad, that we have found interesting as you and I have talked is kind of the way the rollout is happening. Obviously, you have groups that have been identified. You have the medical personnel, important. They need to get vaccinated. They're treating people. You have elderly people who are in facilities that need to be treated. I think that's a second group that's been identified. There's some places, some states that have decided to kind of go their own route and maybe not follow the CDC recommendations for having those two groups treated first. What is your thought about not having a federal mandate saying this is who needs to be treated first, this is who's going to be in the second group, the third group, and follow that across the board?
I think that is vital, and not to make this political, but I think that that is vital to have a federal mandate. And with the federal mandate, there's more equity. Um, and that's the most important thing. There's equity of distribution of the vaccine. Certainly, healthcare providers who are on the front lines, and I'm not on the front line. I don't want people to think that I'm in the ICU taking care of COVID patients. I'm not, but those people should be vaccinated first. Those people in long-term facilities with the elderly, those people who work there should be vaccinated. And another interesting point is not only the physicians and nurses should be vaccinated, and at Duke Health, the respiratory therapists, the people who clean the rooms, environmental services, those are all important members of the healthcare team that deserve an equal shot at vaccination, and they should get it too. As far as how it's rolled out by states, I think that if you do it on a state by state basis, there inconsistencies and inequities, and the federal mandate would be very important.
Okay. And we're still looking to figure out, and this is just our last few seconds, still trying to figure out the effectiveness and the length of time that somebody would be safe, whether we have to get this shot every year or not. Is that correct?
That's correct. No one knows that. I spoke to my infectious disease friend just the other day and asked him that very question, and he said, "No one knows. This is just step one. I know the country wants to just put this behind us. The world wants to put it behind us, but again, this is a new disease, and no one knows. And the important things that we can do include masking, distancing, avoiding gatherings, washing our hands."
Okay, so as we leave and as we sign out, and this has been such great information, Brad, I just want to leave folks with a few nuggets that you brought up. You feel that federal mandates are critical, not to be politicized, but just because there's our timer, by the way, going off, just because it is necessary to kind of have equity. You talked about that. You talked about continuing to be vigilant, continuing to mask, continuing to social distance, continuing to not gather in large groups. You also talked about why there was this concern about some folks getting the vaccination, but in your mind and in others' minds of the medical field, the feeling is that it is critical to get to about 80% of compliance so that most can be protected and we can get back to some level of normalcy.
That's correct. You summed it up nicely, Verna.
All right. Well, thank you so much, Bradley, for being with us today. I enjoyed it. I always like talking to you, as you know. So this was a great time for me to kind of find out a little bit more about you. And one thing I'm going to do too, Brad, at some point is contact you about talking about transplant
Right.
during a COVID era. I think
I
that's
actually,
very important.
yeah, I
So
actually know something about that. So
a little
I'd,
thing or two, a little
I'd
thing.
be happy to talk about transplantation and COVID. Uh,
Awesome. Awesome. Well, you have a great day. I'll talk to you later. Happy New Year, everybody. Thank you so much for coming in for your bite today with us. And we will be back next week with another one. Be sure to join us then. Have a good one. Bye bye.